Hi there, my name is Manika Pai and I'm a thrombosis physician from Hamilton, Ontario. I'm also a member of Thrombosis Canada, and today I'm delighted to have Dr. Shannon Bates here with me. Dr. Bates is also a thrombosis physician from McMaster University, and she is a world expert in venous thromboembolism, also known as VTE, and women's health. So Dr. Bates, thank you so much for being here. I think what we've found is that not just patients, but also healthcare providers have a lot of questions about thrombosis in pregnancy. So maybe I can ask you a very basic question. How common is it for pregnant women to get blood clots? And does that risk change during the course of the pregnancy?
So that's a great place to start. So if we roll it back a bit and think about women in their 20s and 30s who aren't even pregnant, if they're not taking the birth control pill, their risk of clotting is about 1 in 10,000 per year. Pregnancy increases the risk of clotting 10 times, so during pregnancy, the risk of clotting is about 1 in 1,000. We know that the risk of clotting is present through all 3 trimesters during pregnancy, but it appears to increase as pregnancy progresses. And in fact, the highest risk of clotting is during the postpartum period, so those first few weeks after delivery.
So it sounds like the risks of getting a blood clot during pregnancy aren't sky high, but they're certainly real. So what signs and symptoms should pregnant women watch out for?
So we're most worried about blood clots in the leg or deep vein thrombosis and blood clots in the lung or pulmonary embolism. So for deep vein thrombosis, you'd be worried about pain and swelling in the leg, and for pulmonary embolism, chest pain and shortness of breath.
Now, those symptoms of swollen legs and shortness of breath could also be normal changes of pregnancy. So how do pregnant women know if what they're experiencing is normal or whether it's a sign of a life-threatening blood clot?
It can be difficult, especially during a first pregnancy. I think you'd be more worried about a blood clot in the leg if the swelling was greater in one leg than in another, if there was redness or other discoloration in the leg, or if you had accompanying pain in the calf or the middle of the thigh. And certainly any abnormal symptoms that progress and get worse should be looked at. For pulmonary embolism, you'd be worried if the shortness of breath continued to get worse, or if it was accompanied by chest discomfort, coughing up of blood, feeling lightheaded, or palpitations.
As healthcare providers who take care of pregnant women, we've always been told that our patient isn't just the woman, it's also the baby. So can these blood clots actually harm the developing baby?
In the majority of cases, no. Mostly it's the mother who will be affected, and in most instances, the symptoms are actually quite mild. However, if the mother has a very serious blood clot, a life-threatening blood clot, then the health of the baby could be affected.
Now, we now know what to look out for if we do find a blood clot. Let's talk a little bit about treatment. Is there any effective treatment for blood clots in these women, and are these medications safe, again, for both the woman and the baby?
Right, so we have a variety of blood thinners available to us. The majority of them cannot be used during pregnancy because they cross the placenta. But we do have a class of blood thinners of heparins and low molecular weight heparins that don't cross the placenta and are safe for the baby. And importantly as well, they're also effective and safe for the mother. The downside of these medicines is they have to be given by a needle underneath the skin once a day, so that's obviously a bit inconvenient and uncomfortable for the mother. So we want to be careful that we are only prescribing these medications to women who really need them.
At Thrombosis Canada, we're trying to promote the idea that the best way to solve the problem of VTE is to prevent it from happening in the first place. So what can women do to minimize their risk of developing a VTE during pregnancy?
So common things that we see in many North Americans, such as being overweight, not very active, and smoking, increase the risk of clotting. So we want pregnant women to work on those factors as a basis for the beginning. And then women and their physicians need to be aware of other risk factors that increase their risk of clotting. So if there's a family history of clotting, if the woman carries an abnormality in her blood that predisposes to clotting, or if she has a medical condition that increases her risk of clotting, for example, heart disease or diabetes or sickle cell disease. It's also important that women know that they're at increased risk of clotting if they're confined to bed for their pregnancy, or if they have some of the pregnancy complications such as preeclampsia. Healthcare providers can make themselves aware of those risk factors by looking on the Thrombosis Canada website, whereas women should be proactive and learn about these risk factors, and they can go to our patient portal at www.vteproblemsolve.ca.
Dr. Bates, thank you so much for joining me today. Venous thromboembolism is a major women's health issue, and we really appreciate all that you have done to raise awareness.
Thank you. It's been a pleasure.